Welcome to another edition of Ask Dr. George. So let's get to it. We're going to talk sedation today. So what are my choices for sedation?
Well, you know what? In dentistry, we offer, a number of sedation options.
Okay.
So they range from, your most basic type of sedation, nitrous oxide, gas.
Is that laughing gas?
That's laughing gas, yeah. So a lot of people like that. Laughing gas is very interesting because it's only really a mild sedative. And what it does is we put a mask over your nose and you breathe in through your nose. Okay? And so it only works if you're breathing it in.
Right.
So what I've found with nitrous is that when people start getting nicely sedated and they're comfortable, they forget to breathe through their nose.
Okay.
And so then what happens is that after a few minutes they start coming out because it's a gas. It has a very, very quick effect. As soon as you breathe it in, within a couple minutes, it starts working. But if you stop breathing it in, within a couple of minutes, it stops working.
Do you still use it a lot?
I don't use nitrous very much because I don't find it to be that effective.
Okay.
And so what you get is this kind of yo-yo effect where they, start getting sedated and they're comfortable. They forget to breathe through their nose. They come back out of it. You have to tell them, okay, take a couple deep breaths through your nose again, and you go back down again for a few more minutes, and it's this up and down. Now, a lot of people like nitrous oxide because you can just breathe it back out again. So after 5 or 10 minutes, you can still leave the office and drive yourself home.
Right.
Okay, so the sedation effects do not linger. They don't last. It's not the same as if you have a drug on board because it's just something that you're breathing in and out. Its effects, the onset is very quick, and its offset is also just as quick.
Right.
And so if you just need a little something to get the edge off so that you can have the freezing done, then nitrous can be very useful for that.
Okay.
There are some side effects of nitrous. It has been linked to birth defects, in women. So it can be problematic for staff because we, in the dental profession, we do tend to have a lot of young ladies who work as our nurses and assistants and this kind of thing. So, we don't want pregnant or about to be pregnant staff members working with the nitrous. Now, what we do is we hook the nitrous, that nose piece is also hooked up to a suction so that, the excess gases that you breathe out are sucked away through the suction and they don't come into the air.
Okay.
But no matter how great your scavenging apparatus is, there's going to be some that gets into the air. So I don't work with nitrous very much because, like I said, I don't like that yo-yo effect. That nose piece gets in my way, especially if I'm doing anterior work, which I do quite a bit of.
Right.
And I just find that the depth of sedation is not great enough for me to do most of what I need to do.
Okay.
If I'm doing surgery or something like that, we need something a little bit stronger than that.
Well, you don't want to be coming out of your sedation in the middle of a surgery either.
So that's why we use things. So understand that sedation is a spectrum. It goes from light to moderate to deep to comatose.
Right.
And so if you're having like a surgery done to heart operation or a gallbladder or something like that, it's not like you can go to the hospital and they can put a little bit of local anesthetic into your heart and freeze it up and then open you up. They can't do that.
No.
Whereas in dentistry we can. So we have good local anesthetic that we can use, so the pain control is taken care of locally with our local anesthetic. And then all we need to use the sedation for is anxiety control.
Right.
Okay. Whereas in general surgery, there is no local pain control. If they're doing a heart operation, they have to basically shut you off.
Mm-hmm.
And so that's what's called a general anesthetic. So general anesthetic would be sedation at the far opposite end of where nitrous would be.
Right.
You're so deeply sedated that you cannot breathe on your own. Like all of those mechanisms are pretty much turned off.
Okay.
And so what they have to do is intubate you, protect your airway, because when you're that deeply sedated, the muscles that hold your airways open, they're so relaxed that the airway will actually close up.
Okay.
Like the muscles that hold it open will collapse on you.
Right.
And so they have to put a tube down and basically you're hooked up to a machine that breathes for you.
Would you ever do that in dentistry?
There are occasions where general anesthetic is required,
Okay.
and that would be with somebody who would, sometimes it could be mental various disorders. Somebody who's not capable of getting an intravenous line in.
Right.
For various reasons, they might use the gas and then put the intravenous line in.
Okay.
Various levels of cooperation are required for some of these sedations. And so, and then also sometimes with young children, because young children can be a little bit unpredictable when you give them drugs.
Right.
Sometimes the drug may have the desired effect, sometimes it has the opposite effect. And so children, you don't know how drugs are going to work. So typically having them in an environment where they can be protected better is always wise. So there are times where, for children, for certain disabilities, where the general anesthetic is necessary.
Okay.
But for just about anybody else, any healthy adult, teenager, anything like that, we don't need to use general anesthetic in dentistry.
Okay, that's overkill then, yeah?
It's kind of a little bit overkill.
Right.
And so what we do on that spectrum, from a 1 or a 2 where nitrous sits to a 10 where general anesthetic would sit, in between we have moderate sedation.
Okay.
And so moderate sedation can be achieved in a couple of different ways. Typically it can be achieved either with a pill that we can crush it up and you can drink it. That's called oral sedation.
Mm-hmm.
Oral sedation works really, really well, but it's designed to be a light sedation because we don't have an intravenous line in. It's more difficult to reverse. We can't control the dose very well. If it's not enough, you can't get a second dose because of the way it's metabolized. It's very difficult to try to titrate or adjust your dosage.
Okay.
So with oral sedation, what you get is you get 1 dose, and with that 1 dose, you're either going to be under-sedated or over-sedated. And there doesn't tend to be, it's very few times that you're going to be perfectly sedated.
Okay.
And so that's the danger with oral sedation, is that we can't really titrate the dose or adjust the dose to get you perfectly sedated where we want you to be.
Right.
So, and the other problem with oral sedation is that it's a very long onset. So typically it takes 40 minutes to an hour for it to work through your system before it starts working.
Okay.
And then it needs to be metabolized to get out of your system. And because it's coming through the GI tract and there's various rates of absorption, when you take a drug through, as an oral, as a pill, then what ends up happening is it needs to be digested before it starts to work. And so people's digestive systems work differently. Some people digest it quicker than others. Some people metabolize it more quickly than others. And so it's very difficult to titrate. You can't add more doses.
Okay.
So oral sedation works, but it's a lot more difficult to deal with.
Yeah, sounds like it.
Yeah, so typically today what we do is we do intravenous sedation.
Okay.
And so an intravenous means that we're putting in a line, typically in your arm or in your hand. And then because it's going directly into the bloodstream, it bypasses the metabolism of your GI tract. So the effects are pretty much immediate. So within about a minute or 2, it's going to be working. And so the way that we do it with IV sedation is that we'll give a small dose to start, and we'll see how it works. If it's working, then that's great. Now we know how much to give you. If it's not working, we can give you more. And because it works immediately, and we bypass the whole metabolism and the digestive system that's going on when you take a drug orally, then we can see its effects immediately. And we can add more, or we can, if it's too much, then we can see that it'll wear off in about 20 minutes generally.
Yep.
So we can control the dosage much better.
So it takes away the guessing, I see.
It takes away the guessing, exactly. So, and with IV sedation, we can also get you to the exact level where we want you to be.
Right.
So I use intravenous sedation on all my surgeries. The effects of sedation are really interesting because basically what we're doing is making you go to sleep.
Right.
So it's not like a drug that impairs your judgment. It's not like alcohol or something like that. These drugs are not drugs that make you silly. These are drugs that just make you tired.
Yeah.
And I like that about them because if I'm doing something, say I'm doing a cosmetic procedure, I can, as the patient is coming out of the sedative, before I administer another dose, I could talk with the patient, and they may not remember that at all because the drugs do have an amnesic effect, but I could ask their opinion on what they think something looks like. And even though they're tired, they will still give me the same opinion that they would give me if they were awake.
And I would imagine maybe it's a little more honest.
Yeah. So it's a very efficient way of us being able to render care and keep people, comfortable.
I see.
And so when we're doing surgery, especially, I like using the sedation because when you're having a surgery, no matter how tough you are going to get somewhat apprehensive or nervous.
Yes.
And what that causes then is your blood pressure goes up. And then when we're doing our surgery with a high blood pressure, you bleed more. It's more difficult for me to see what's going on when there's a lot of blood in the area. And that excess bleeding isn't a positive thing.
Right.
Right? And so we can do the procedure faster, quicker, more efficiently, less bleeding, less post-operative problems when somebody has been sedated. So typically today, if we're doing wisdom teeth, if we're doing any kind of oral surgery, even long dental appointments on apprehensive people, we can do all of those things with intravenous sedation. We can control the drug. And the really nice thing with intravenous sedation is within about 20 minutes to half an hour, the patient is ready to go home.
Okay.
And they're not, still drugged up.
Right.
Whereas with the oral sedation, even though we're using the exact same medication, the oral sedation, the hangover effect could be 3-4 hours, maybe even longer.
Right.
And so with the intravenous sedation, I think it's much safer.
I think so too.
Yeah, so that's those are your options with respect to sedation and dentistry. So on the light end, we have nitrous oxide, and on the medium end, or a little bit more, would be the oral sedation. Then we go to IV sedation, and then we go to general anesthetic. And sort of in that order. Now, for general anesthetic, you would need to either be done in a hospital, or you need a dental or medical anesthesiologist, a specialist in anesthesia, to come in and manage that for you.
Right.
And so some docs are still using general anesthetic to do wisdom teeth. My personal opinion is I think that's a little overkill for most people. It's not really necessary. But some docs still like to do it that way.
Okay.
But I think the profession is moving more and more towards IV sedation. It's less deep. We don't have to intubate you.
Right.
So I think it's, in that respect, we eliminate some of the risks. And I think by having a moderate sedation where your airway is still supported, the muscles haven't become so relaxed that the airway collapses, so we don't need to intubate you.
Right.
So I think that is a little bit safer way to go than being completely, out of it.
Right, for sure.
So I think that's all you need to know about sedation, and hopefully you found this an interesting discussion. Thanks for listening.